There has been a lot of uproar over the UK Home Office regarding changes to the health and care visa. You are welcome back to Travel and Work. We always bring you the latest updates, news and information about traveling, working, studying and living abroad. If this is your first time on this channel, you are welcome and I hope you are doing great. The recent announcement by the UK Home Office about the changes to the health and care visa has caused a lot of confusion among healthcare professionals, their dependents and the general public. The previous Home Office news stated that all health and care workers would no longer be able to bring their dependents to the UK. Now the Home Office has had to issue a clarification about the situation, stating that the changes only apply to care workers and not NHS staff. It also does not affect nurses and doctors. So, nurses and doctors and other health professionals who are not carers and senior carers in the UK can still bring their dependents. This video aims to clear the ground and provide a detailed explanation of the new regulations, so that everyone would be clear about things. Before I continue, kindly subscribe to our channel if you have not. Turn on the notification bell to be notified when we upload a new immigration update. Thank you. Now, let's continue with this update. On December 4, 2023, the UK Home Secretary, James Cleveland announced a 5-point plan to reform the immigration system including changes to the health and care visa. In his statement, he stated that the health and care workers will not be allowed to bring any dependents to the UK. The public knows that health and care workers are all in a bracket that refers to the nurses, doctors, carers, senior carers and all those working in the health and care sector as it's been defined. Now, the UK NHS has issued a publication clarifying this Home Office announcement. It says that the specific groups affected by the changes on the 5th of December are carers and senior carers who work directly with people. The publication made it clear that the NHS staff including nurses, doctors and other healthcare professionals are not affected and can continue to bring their dependents to the UK. Also, the NHS employers remain exempt from the new salary threshold requirement. They further stated that the government has reassured them that they will reduce net migration. They understand the importance of international educated health and care workers. They also know that these changes will result in a series of questions. The unclear statements from the UK government and its NHS have caused uncertainty. In order to be clear on this situation, these changes are as follows. The NHS is an organisation known as the National Health Service and they are in charge of the UK health sector. They have shed light on the statement by the UK government. They said that the government assured them that this was to reduce the abuse of that visa route. In the statement, the Home Secretary reference was a health and care workers visa. He was referring to the care and senior carers visas only, and not referring to the general health and care sector as a whole. To be clear, those affected are care workers only. This includes care assistants, senior carers, home carers and other professionals who work directly with patients in care homes, residential, private settings, hospital and the community care services. Those who are not affected by the changes are the NHS staff and it includes nurses, doctors, consultants, therapists and other healthcare professionals employed by the NHS. These individuals are not affected by the changes and can continue to bring dependents with them to the UK. The NHS published a frequently asked questions. You that reads through these online for more clarification. Just log on to www.england.nhs.uk/events/faqs/. So, with the recent updates to the health and care visa, which have brought a lot of confusion, it is important to depend on the official statements from the UK Home Office and the UK NHS for valid information. As you can see now, the changes only affect care workers. Even with this clarity, the future of the UK's healthcare workforce and the ability to attract and retain skilled professionals remains unclear. It is also not clear the impact these changes will make with carers not coming to the UK anymore, but rather choosing other countries where they are needed. I hope you are all clear on this issue now. You want to have a nice day, till I see you in the next video.